Dr. Narissa Bauer, welcome.
Thank you for having me, Dr. Rensel.
How are you?
I am great. How are you?
I'm good. I'm good. I'm honored to have this time with you. I love what you're doing, helping all little people out there and helping people who help little people. So tell me about your coaching for pediatricians, how you're supporting pediatricians and all the important work that they do.
Yeah, I guess I'll answer that question by going back just a teeny bit to
Sure,
just give viewers an idea of who I am. So I'm a
absolutely.
behavioral pediatrician by training, and I sort of have had a kind of a different route to getting to where I am. I did a general pediatrics residency in San Diego, and then I did an extra clinical year of developmental behavioral pediatrics before it was a board certified specialty with Dr. Marty Stein. And then I went on to do a master's of public health at the University of Washington, where I did some research looking at intimate partner violence and bullying in children.
Okay.
Right. And then I got my first faculty position at Indiana University, where I was tasked to start a developmental behavioral rotation and start a behavioral clinic. And that's kind of where I got my start, was actually in Seattle, because when I was in Seattle, I started a foster care clinic. And
Oh,
as you know, many of those children have a lot of behavioral issues. And I realized, because I didn't have my own kids, and I knew that, oftentimes these problems did not need medication. Like sometimes they did, but most of the time it was parenting support. And I thought, oh my
right,
gosh, I have no idea how to support these parents. And you
right.
want to prevent disruption from placement, and I just was feeling very inadequate. And so what I did was I searched the community, and thank goodness I happened to find a woman, Carolyn Webster Strand, who eventually became my mentor and a good friend. She's the developer of the Incredible Years evidence-based parenting curricula. At the time, it was already evidence. There was a lot of research on it for use with children who have oppositional defiant disorder and conduct disorder.
Okay.
But when I reached out to her, she just happened to have landed a grant from SAMHSA to adapt it for use with kids with ADHD.
Oh,
So she said, well, the best way to learn my program is to participate. And I know you
right.
don't have kids yet, but let's just do it. So I
Oh,
did that. It was a 22-week course, Tuesday
wow.
nights,
Yeah.
parents in one room, kids in another. She
Oh,
would video
interesting.
record it.
Mhm.
And then she also invited me afterwards, um, like in between those sessions, to meet with her and her her group facilitators to review videotapes. And basically, I learned not just the content, but how she was thinking and how she facilitated these groups.
Nice.
I mean, I
Yeah.
couldn't have asked for a better training,
Right.
right?
Oh, that's amazing.
Right. And then afterwards, I realized pediatricians are not taught this in this systematic way. It's usually in medicine where we see one, do one, teach one, but for
Right, right.
parenting, that doesn't really work well,
Yeah.
because there's not a one size fits all approach. So Dr. Webster Stratton asked me to write a review paper with her for current articles in pediatrics, and we talked about prevention of behavior problems in primary care. And then with her blessing, I worked with her to adapt her program that was for parents, but instead to adapt it to teach residents how to coach parents
Oh,
on
nice. Yeah.
integrating it into well child visits.
Nice.
So I
Amazing.
began doing that at the medical school. Began presenting it at conferences nationally, and it was a lot of fun because pediatricians are asked these questions, and yet nobody was doing it in a systematic way.
Right.
So we were teaching all about like how to coach parents on child directed play, praise, timeout, tangible rewards, consequences, all of those different things
Mhm.
that pediatricians should feel comfortable talking about. So fast forward, I still to this day am involved in a lot of efforts with the American Academy of Pediatrics to get this information out. We just
Nice.
completed, we're working on, and it will be completed soon, an EQUIP module for uh, parenting in primary care. So that way, pediatricians who need MOC credit can go through that course and complete it. But
Nice.
since I've left academia in December of 2018, I've also begun kind of talking with other physicians out there who are in private practice or entrepreneurs and want to launch into parenting. And
Mm-hmm.
so I've been slowly taking on some clients to help kind of figure out what is their vision for how they want to, use this body of knowledge, whether it be to develop a course or develop it into their workflow and their practice, and then
Right.
filling in the gaps and working with them so that they can achieve that goal.
Amazing. Such a resource. I can't, I'm a mom of four and I can't imagine, my sister has four kids. We've all, we've just, people that I know, of course, you look for resources and you hope to find it. And sometimes if it's too hard to find it, you just keep going, right? You just think, okay, I guess I
Yes.
just have to kind of keep going or deal with the school will help as much as they can. But yeah, so a lot of folks get bounced between, or, search between their medical providers and their school and then anyone in their community that could help them. So I love that you're providing these resources and the people you've worked with. I love that all these
Yes.
families are being supported in new ways by residents learning, learning at least the basics of how to support the parents. That's
Right. And
amazing.
how to talk about it, right? I mean, I think there's
Right.
this, I oftentimes heard from residents who said, gone through our rotation and they're like, the parents are like, do you have kids? And some of
Right.
them are like, no, I don't. So of course that sort of leaves, like the resident feels inadequate to be providing
Sure.
this. But
Mm-hmm.
I tell them, I'm like, hey, listen, you have seen to this date so many kids. You
Right.
are an expert. You don't
Right.
have to be a
Right.
parent yourself, but you know
Right.
enough about child development
Oh my
and
gosh.
how to take care of kids that you can do this. But I mean, I understand that parents like to be able to relate to somebody
Yes.
who kind of walked in their shoes. Um, but I think just like we teach residents how to take care and delineate like sick from not sick, or an
Right.
asthma exacerbation that needs to be you know admitted versus not.
Mm-hmm.
It's just one of those things. We're taking care of kids' health, and it's a huge part of promoting positive social emotional growth, as well as nurturing that parent-child interaction.
Wonderful. So what pediatricians should reach out to you? Like what are they, kind of bumping into if they want to learn more about, is it ADHD mostly or what would you say?
Yeah, well, I mean, I think I've certainly applied these parenting concepts across the board, to anxiety, ADHD, and just general well child visits. But I would say, in general, those physicians who are in private practice, because there's such a need. I mean, especially if anything, COVID has amplified the fact that parents, when they get in that office, they're struggling because their kids are struggling right now, and just
Mm-hmm.
how to help provide that guidance, and what to say or how to say it, how to screen for things, how to work this all so it's seamless in your workflow. So
Mm-hmm.
for those pediatricians who are getting a lot of those questions and don't feel like they've had adequate training in this area, they can reach
Mm-hmm.
out to me. And then also, anybody who is an entrepreneur and wants to sort of, break out and offer programs or classes or, their own coaching business
Mm-hmm.
revolving around parenting. I love to think outside the box.
Mm-hmm.
And as you know, I said parenting is not a one size fits all approach. So that's where the magic happens, is sort of thinking about like how to make this work in whatever setting you're in. Because I know for a long time, it's been really terrible reimbursement for this type of work,
Okay.
especially in very busy pediatric clinics. But it's so needed. And so I've been uh, involved in ongoing efforts with the academy to kind of figure out and get payers to pay for this type of work. It's so important and so needed. And I think that pediatricians recognize that, and they're really wanting to continue to do it regardless of if they're paid. I mean, yes, you need to pay attention to the bottom line, but in the
Mm-hmm.
end, the patients need what they need.
Mm-hmm.
Um, and so, just one quick plug for the American Academy of Pediatrics. I'm the chairperson of the STAR Center Technical Assistance Committee. STAR stands for Screening, Technical Assistance, and Resource Center. And we have resources on there. So if you're interested in screening for developmental delay, maternal depression, social determinants of health, we have videos, we have MOC credit. We have implementation resources. We have a podcast that I host with called the Pediatric Care, standing for Childhood Adversity and Resilience Education. So that's a
Oh, I love
podcast
that.
for
Mhm.
pediatricians and providers to learn more and dive deeper into topics. And then we also are going to start office hours. So that way, if practices have questions about all of these different things and how to make it work, they can tap into that resource too.
Oh my gosh, you are just a treasure trove of so many gifts for all these folks who are in the trenches,
Oh,
huh?
yeah, no, it's so
Wonderful.
needed. And, just knowing where to go for reliable resources, I think is important.
Yeah.
So thank you for the opportunity for me to
Oh
share
my gosh,
this.
I love learning about all that you're up to. That's amazing. So, American Academy of Peds, and they can listen to the podcast is a
Uh-huh.
good start, and then reach out to you if they want to, any entrepreneur or pediatrician or someone who wants to, build more resources for
Yes,
parents. And yeah,
yes,
I love that because then that's so strategic. Because then if the parents really feel good and strong about that, they can share it. And I feel like when the kids have more tools, life tools, then they shine, and it's wonderful. So thank
yes.
you for all that you do. And we'll put all your links in the show notes.
Great. Thank you so much.
Okay. Wonderful. Stay well.